Ever wonder why we draw an ABG instead of a standard venous sample? Many people confuse where the blood actually comes from during this procedure. ABG stands for arterial blood gas, meaning we need oxygen-rich blood directly from an artery. This measurement is crucial for checking a patient's respiratory and metabolic status.
The most common site for an ABG draw is the radial artery, located in the wrist. Unlike venous blood, arterial blood has just left the heart and lungs, accurately reflecting oxygen and carbon dioxide levels. This provides a precise snapshot of how well the lungs are oxygenating the body. It tells us the true pH balance and gas exchange efficiency. Because arteries are under high pressure, you must apply firm, steady pressure for at least 5 minutes after sampling. This prevents hematomas and ensures patient safety in the clinical setting. Always remember that for these specific labs, we use arterial blood only. Proper technique ensures accurate results and minimizes patient complications.